Welcome to Psych Circles, your trusted source for mental health education and support. Imagine feeling trapped in a never-ending cycle of intrusive thoughts and repetitive behaviors, unable to break free. For those living with OCD, this is a daily reality, but there is hope. By understanding OCD and implementing effective strategies, it's possible to regain control and lead a fulfilling life. Stay tuned as we unravel the complexities of OCD and explore practical solutions to manage it. Obsessive-Compulsive Disorder, often simply called OCD, is a chronic mental health disorder characterized by two main components: obsessions and compulsions. Obsessions are recurring, unwanted thoughts, images or urges that intrude into a person's mind, causing significant anxiety and distress. These obsessions are not simply everyday worries or concerns. They are persistent, often irrational, and feel uncontrollable, leading to intense feelings of fear, disgust, or doubt. Compulsions, on the other hand, are repetitive behaviors or mental acts that individuals with OCD feel driven to perform. These actions are an attempt to neutralize the anxiety caused by obsessions, providing temporary relief. Common compulsions include excessive hand-washing, cleaning, counting, checking, and arranging. While these compulsions may offer a brief respite from anxiety, they can become incredibly time-consuming and interfere with daily life. Understanding OCD is the first step towards managing it effectively. Stay with us as we delve deeper into strategies and treatments that can help those affected lead a more balanced life. Obsessions, the intrusive thoughts that plague individuals with OCD, can take on many forms. They often center around specific themes, such as contamination, orderliness, harm, religion, or sexuality. Let's take a closer look at some common types of obsessions. Contamination obsessions, fear of germs, dirt, bodily fluids, or chemicals, leading to excessive cleaning, hand-washing, and avoidance of perceived contaminants. Symmetry and orderliness obsessions, intense need for things to be symmetrical, organized, or in a specific order. Harm obsessions, intrusive thoughts about harming oneself or others, even though there's no desire or intention to do so. Religious obsessions, persistent, unwanted thoughts about religious themes, such as sin, blasphemy, or offending a higher power. Sexual obsessions, intrusive thoughts, images, or urges related to sexual acts or themes that are unwanted and distressing. Compulsions, the repetitive behaviors or mental acts performed in response to obsessions, are an attempt to manage the overwhelming anxiety and distress caused by intrusive thoughts. These actions provide temporary relief, but can become extremely time-consuming and interfere with daily life. Here are some common types of compulsions. Washing and cleaning compulsions. Excessive hand-washing, showering, cleaning surfaces, or disinfecting objects to alleviate contamination fears. Checking compulsions. Repeatedly checking locks, appliances, switches, or other objects to ensure safety and prevent perceived harm. Counting and ordering compulsions. Need to count objects, perform actions a certain number of times, or arrange things in a specific order to alleviate anxiety and feel a sense of control. Mental compulsions, repetitive mental acts such as praying, counting, or repeating phrases to neutralize obsessions or prevent perceived harm. It's important to remember that individuals with OCD don't enjoy performing these compulsions. They feel compelled to do them to alleviate the overwhelming distress caused by their obsessions. Section 5. Unlocking the mysteries, the science behind OCD. While the exact causes of OCD are not fully understood, research suggests that a complex interplay of genetic, neurological, behavioral, cognitive, and environmental factors contribute to its development. Let's delve into the science behind this often misunderstood condition. Genetics. Studies have shown that OCD tends to run in families, suggesting a genetic component. Neurology brain imaging studies have revealed differences in brain activity and structure in individuals with OCD compared to those without the disorder. Behavioral factors. Learning theories suggest that compulsions may develop through a process of reinforcement. Cognitive factors. Individuals with OCD often have specific thought patterns and beliefs that contribute to their symptoms. Environmental factors. Stressful life events, trauma, and infections have been linked to the onset or worsening of OCD symptoms. It's thought that these experiences may trigger the disorder in individuals who are already genetically or biologically predisposed. Section 6. Spotting the signs. Recognizing OCD in yourself or a loved one. Recognizing the signs and symptoms of OCD is crucial for seeking timely intervention and support. If you or someone you love is struggling with intrusive thoughts, repetitive behaviors, or excessive anxiety, it's essential to consult a mental health professional for a proper diagnosis. Here are some common signs of OCD. Presence of obsessions. Recurring, unwanted, and intrusive thoughts, images, or urges that cause significant anxiety and distress. Engagement in compulsions. Repetitive behaviors or mental acts performed in response to obsessions to alleviate anxiety, even if these actions are excessive or illogical. Excessive time spent on obsessions and compulsions. Significant time devoted to engaging in obsessive thoughts and compulsive behaviors, often interfering with daily activities, relationships, and responsibilities. Section 7. Breaking free. Effective strategies for managing OCD. While OCD is a chronic condition, there are effective strategies and interventions that can help individuals manage their symptoms and live fulfilling lives. The key is to seek professional help and develop a personalized treatment plan tailored to individual needs. Here are some key strategies for managing OCD: cognitive behavioral therapy, CBT, a type of therapy that focuses on identifying and changing negative thought patterns and behaviors associated with OCD. Exposure and response prevention, ERP, a specific type of CBT that involves gradually exposing individuals to their feared situations or objects while preventing them from engaging in compulsions. Medication. Certain medications such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, can be helpful in reducing OCD symptoms. Section 8. The power of therapy. Cognitive behavioral therapy, or CBT, for OCD. Cognitive behavioral therapy is considered the gold standard treatment for obsessive-compulsive disorder, or OCD. This form of therapy focuses on identifying and changing the negative thought patterns and behaviors that contribute to OCD symptoms. CBT helps individuals challenge their obsessions, reduce their anxiety, and develop healthier coping mechanisms. During CBT sessions, therapists work collaboratively with individuals to understand their specific obsessions, compulsions, and the triggers that exacerbate their symptoms. Together, they develop a personalized treatment plan that addresses their unique needs and goals. One of the core components of CBT for OCD is exposure and response prevention, or ERP. This technique involves gradually exposing individuals to their feared situations or objects while preventing them from engaging in compulsions. Section 9. A helping hand: medications for OCD. In some cases, medication may be recommended as part of an OCD treatment plan, often in conjunction with therapy. Medications can help reduce the severity of OCD symptoms, making it easier for individuals to engage in therapy and manage their condition. Selective serotonin reuptake. Inhibitors, or SSRIs, are typically the first-line medication for OCD. SSRIs work by increasing the levels of serotonin, a neurotransmitter in the brain that plays a role in regulating mood, anxiety, and obsessive-compulsive behaviors. Serotonin norepinephrine reuptake. Inhibitors, or SNRIs, are another class of medications that may be used to treat OCD, particularly if SSRIs haven't been effective. It's important to note that medication is not a quick fix for OCD. Section 10. Finding your center: mindfulness techniques for OCD. Mindfulness techniques have gained increasing recognition for their effectiveness in managing anxiety and promoting overall well-being. For individuals with OCD, mindfulness practices can be particularly helpful in reducing stress, managing intrusive thoughts, and developing a greater sense of self-awareness. Mindfulness involves paying attention to the present moment without judgment. It's about observing thoughts, feelings, and sensations as they arise without getting carried away by them. By practicing mindfulness, individuals with OCD can learn to detach from their obsessive thoughts and reduce the urge to engage in compulsions. One common mindfulness technique is mindfulness meditation. This involves finding a comfortable seated position, closing your eyes, and focusing your attention on your breath. Section 11. A circle of support: the importance of family and friends. Living with OCD can be incredibly isolating. but it doesn't have to be. Having a supportive network of family and friends can make a world of difference in an individual's journey to recovery. When loved ones understand the challenges of OCD, they can provide invaluable support, encouragement, and understanding. One of the most important things family and friends can do is to educate themselves about OCD. Understanding the disorder, its symptoms, and effective treatment options can help them better support their loved one and reduce any stigma or misconceptions. It's also crucial for loved ones to be patient and understanding. Recovery from OCD is a process, and there will be ups and downs along the way. Section 12. Navigating life with OCD. Practical advice for families and individuals. Navigating life with OCD can be challenging, but there are practical steps to manage it. Seek professional help. Early diagnosis and treatment are crucial. Educate yourself. Learn about OCD, its symptoms and treatments. Practice self-care. Engage in activities that reduce stress and bring joy. For families and friends, be supportive and understanding. Offer unconditional support, patience, and understanding. Section 13. The journey to wellness, long-term management, and maintaining progress. Recovering from OCD is an ongoing journey, not a destination. While there's no one-size-fits-all cure, with the right treatment, support, and self-care strategies, individuals with OCD can manage their symptoms effectively and live fulfilling lives. Here are some key strategies for long-term management and maintaining progress. Consistent treatment. Consistency is key in managing OCD. This means attending therapy sessions regularly, taking medication as prescribed, and practicing coping skills consistently, even when feeling well. Lifestyle modifications. Making healthy lifestyle choices can significantly impact OCD symptoms. This includes getting enough sleep, eating a balanced diet, exercising regularly, and avoiding alcohol and drugs, which can worsen anxiety and interfere with treatment. Stress management. Stress can trigger or exacerbate OCD symptoms. Incorporate stress-reducing activities into your daily routine, such as mindfulness meditation, deep breathing exercises, yoga, or spending time in nature.